Ajakande, communication officer at the expanded program on immunization, in an interview with Caravan News Network, updated the public on polio outbreak and further explained their interventions geared towards trimming polio-related conditions in the country. Ajakande said they have been having polio surveillance programs, as every week they have their data indicating latest information on polio. She was quick to add that their interventions were not enough, which prompted them in May of 2019 to embark on the environmental sampling surveillance, which is meant to collect samples of sewage water to be subjected to intense laboratory examinations to confirm the presence of virus in the sewage, particularly in the areas of Banjul and Kotu where the sewage is disposed. She added that in the international regulations, every case of a polio is considered an outbreak, and that they found out that the Gambia is part of the countries where polio outbreak was declared, to Dr. Amadou Lamin Samate, the Minister of Health.
Respond to that outbreak, we had the first polio campaign in November 2021, and the second round came last month, which was March 2022. So that was why we went into the polio campaign, because we were responding to a disease outbreak, which was polio, to 59 months, which is including newborns. Children who are just delivered up to the age of 5 years, those were the children that we were targeting for all the rounds, both first round and second round.
Kande, while explaining the challenges of implementing the first vaccination, which was administered at the same period with COVID-19 AstraZeneca vaccination, said
it was a challenge in the first round, that we did some education, that is health education, but it was not very well done, because we were rushing it, because we were responding to an emergency. And you know, for somebody responding to an emergency, you don't have time to plan proper. So that was why for the first round, we could not reach out to everybody about the vaccination, and that people were having some misinformation about the vaccine, which was totally different from the COVID. And we know COVID, we are targeting people who are age 18 and above at that time, and polio is targeting under 5s. So it's a totally different vaccine, and it's a totally different disease condition. But people didn't know, because we did not conduct a lot of sensitization. The few that were conducted were also rushed, and it was in a very untimely manner. That was why people were confused.
Kande continued that according to their database, about 90% of households were aware through different media platforms compared to the first phase.
For example, if we feel like we still have some more threats of the virus, we still can go ahead another round. The second thing is, if you feel like our coverage was not as we expected it, or we want a booster, we can still go ahead to do that. But we have technical experts, including WHO, UNICEF, and other partners who will advise us as to what we are going to do the next step. So we are working with partners who will update us or help us to come out with decisions that we are supposed to do. One thing I want to assure the public, that all the vaccines that we are giving out are very safe and effective against the diseases that we are giving out for them. For example, the polio vaccine. The polio vaccine has been in country since 1979, and this is not the first time. It's not a new vaccine. It's the same vaccines that we are giving at the clinic at RCH, where we call the nurse. So it's the same vaccine. Maybe the new vaccine here is going to be the COVID, because it's the first time it is coming as a vaccine in the entire world, not only the country. So all the other vaccines, or all other vaccinations, the vaccines that we are giving are the same vaccines in our clinics. That is the nurse that we are giving out. So let them understand that all those vaccines have been very effective and have been proven to reduce most of the vaccine preventable diseases like polio, meningitis, measles, rubella, and so on. You count on them. So you have been, if you are an elderly, you perhaps witness so many childhood illnesses in the 80s, in the 70s. But gone are those diseases now because of the use of the vaccine, because they are very effective. We used to have neonatal tetanus. We used to have yellow fever. We used to have measles, meningitis, and you count them among children. And most of them will die if they catch the disease.
The effects of polio have been known since prehistory. Egyptian paintings and carvings depict otherwise healthy people with withered limbs or young children walking with canes. The first clinical description was provided by the English physician Michael Underwood in 1789, where he refers to polio as the debility of the lower extremities. Reporting for Kairaban News Network, Mama A. Toure.